Hi, I'm Christy Butler, the Manager of Primary Care Clinical Pharmacy Services with Providence Medical Group in the Oregon region. If you're watching this, I'd first like to thank you for your interest in our pharmacy physicians. I'd also like to thank you for taking the time to watch this before you meet with us. With this recording, I will be providing some background information about our health system, clinics, pharmacy department, and our services. That way, we can spend more time talking about your experiences and answering your questions during our interview. So let's start with the 30,000-foot view. Providence Medical Group is part of Providence Health and Services. A couple of years ago, Providence Health and Services and our affiliates joined with St. Joseph Health and their affiliates, and we all became Providence St. Joseph Health. This new organization is the third largest not-for-profit health system in the country, with over 50 hospitals and 800 clinics, 25,000 employed physicians, and nearly 120,000 employees, or as we call them, caregivers, as well as many other healthcare and non-healthcare services. This is the geographic footprint of Providence St. Joseph Health. And though we are all part of Prov St. Joe's, as we are nicknamed, for now, each ministry still goes by its own name in their local area. For example, we're still known as Providence Health and Services in the Oregon region. So you can see by the map and the coloring distinction how the local branding goes. From here on out, we'll be talking mostly about Providence and specifically the Oregon region. Providence, especially in Oregon, is an open integrated health system, meaning that our hospitals, clinics, and a health plan and insurance company, as well as other clinical services, are all integrated and all under the Providence name. We're open in that patients with Providence Health Plan insurance may go to Providence or non-Providence employed physicians and hospitals, and our Providence clinics and hospitals see patients with other insurances besides Providence Health Plan. So this leads to this Venn diagram as a visual representation. As part of Providence Medical Group, the ambulatory care pharmacy services collaborate with providers and pharmacists in all of the other service areas in Oregon. Specifically speaking about pharmacy services in Oregon, we have robust pharmacy practices across lots of different environments of care, and we collaborate together. For the purposes of this meeting, we're going to be focusing on the medical group. And we'll be talking about where we exist and our services. Geographically, we have clinics and therefore also pharmacists across the state grouped into 4 service areas. North, which is the Portland metro area, South, which is the Medford metro area, North Coast, which is the Seaside area, and the Columbia Gorge, which is Hood River. If you're not familiar with Oregon, here we are. The smaller service areas are noted here. So we have 2 clinics in Hood River, and currently we don't have a clinical pharmacy specialist in primary care there, but they have some consultative pharmacy services from the hospital pharmacists in those primary care clinics. Seaside has 3 primary care clinics and 1 clinical pharmacy specialist in primary care, and the Medford area has 8 primary care clinics with 3 clinical pharmacy specialist positions there, and we plan to be growing. The bulk of the clinics, as well as the pharmacist positions in our team, are in the Portland metropolitan area. So we have about 36 primary care clinics around Portland, and currently 19 of our clinical pharmacy specialists are located in the expanded Portland metropolitan area. And we are very generous when we talk about the Portland metropolitan area because it extends well beyond the borders of Portland. From the center of Portland, our clinics go out in every direction about 45 to 60 minutes from downtown. Our department lives within the medical group, as well as having, as I mentioned, pharmacy services and other lines in other environments of care. The medical group's pharmacy department is unique in that we are completely non-distributive, and our focus is on providing clinical education and operational support. We do this through a combination of decentralized and centralized services. Our goal is to always be promoting effective, evidence-based, safe, and cost-effective drug therapy for all of our patients. While the physicians that you are interested in live within the primary care team, our department has lots of primary care services. So in addition to our primary care clinical pharmacy specialists, of which we currently have 22 pharmacists with one open position, and hopefully for 2019 and beyond, continuing additional positions. We also have 4 PGY2 residents, 3 of which are in the Portland area and 1 is in Medford starting this year for 2018, and we'll be continuing that in 2019 and beyond. In addition to our primary care services, we also have hospital and innovative locations of practice for anticoagulation services and pharmacotherapy clinics, and these pharmacists are managing both traditional anticoagulants like warfarin and the newer agents with the DOAC therapies. The pharmacotherapy clinic element of that is they are managing and prescribing high-risk, high-cost medications, for example, hepatitis C, multiple sclerosis therapies, HIV, etc. And this is an expanding area for Providence in Oregon. Our medical group also provides pharmacy services through a centralized refill and prior authorization service, a robust medication assistance program, and a pharmaceuticals and vaccine management program for our clinics. Here is our current and most recently updated org chart, and I say most recently because just this week, as I'm recording this, we have added a medication safety officer to our team. So we are very excited to be able to have a dedicated person for the medical group to work with our risk and safety team focusing on medication safety. As you can see, the other service lines or the other teams within the department are called out. So our primary care team has the specialists, the residents, as well as some support staff who are indispensable to our ability to provide excellent care to our patients and clinics. We're going to focus a little bit on what the activities of our pharmacists and by extension our residents are. About 80% or more of our work really relates directly to patient care. We provide our patient care through a combination of direct or through collaborative management for chronic disease management with CPAs, which we'll talk about in just a second. And we do this through a combination of office visits as well as telephonic visits. And we're continuing to explore other ways to provide telehealth in more technologically savvy approaches. Then we also provide information and care to our patients and to assist our fellow clinicians, our physicians, through consults and drug information. We can either do that as specific drug information questions or targeted reviews or comprehensive medication management. And this also includes looking at ways we can help our patients afford their medications. A growing area, but something that we've done for a long time, is population health management. With 2018, the Oregon region of Providence Medical Group has over 70% of our patients that we care for in some sort of alternate payment model. So we have patients who are either in full capitation or shared risk or shared savings contracts and lots of elements of pay for performance. So this is continuing to drive our efforts to try to help meet the triple and or quadruple aim by improving quality, lowering costs, and increasing both patient and caregiver satisfaction. And the pharmacists are widely utilized and considered an integral part of our population health management efforts. So in addition to those patient care activities, we also provide education, and we'll talk about that in a little while later, and we can work on, and we are often involved in projects, particularly within the clinics in innovating how we provide primary care, but also some pharmacy-specific projects. Our clinical pharmacy agreements include both our practices in Oregon and our clinics in Southwest Washington. In both Oregon and Washington, we have progressive collaborative practices. So our agreements as listed for different disease states are kind of a starting point. They are guidelines and not algorithms. And if physicians or other members of the healthcare team have patients they want us to work with that fall outside one of these areas, we can with some additional clarification. Because we have this broad area of practice, we expect and really require that all of the pharmacists are proficient in the management of a broad array of chronic disease states that are common in primary care. So while diabetes, hypertension, and ASCVD are the big three in primary care and are still the big three of what we manage day to day, we are prepared for anything that our providers may ask us to work on. I want to highlight that pain is italicized. This is a little bit different than our typical collaborative agreements in that our extensive work within the medical group around pain and opioid stewardship comes with a little bit different delivery. We do most of our recommendations as consults for pain rather than doing more of an autonomous opioid management independently. We have, as you may have seen at the very first header slide, pharmacists have been part of the Providence Medical Group in Oregon for over 21 years, and we have long been included as an integral member of the team. But in recent years, we've really grown our patient-centered medical home approach and really developed our team-based care model. So in addition to having pharmacists and physicians and medical assistants and front desk staff, we now have robust teams with advanced practice clinicians, diabetes educators, case managers, clinical nurses, behavioral health, all kinds of abilities that complement each other. And what I really love about the patient-centered medical home model is this idea that all members of the team are practicing at the top of their license. So we do a lot of innovation in our clinics about who can be doing what and how we complement each other and provide the patient with the best, most affordable care. I had mentioned before our educational efforts, and one might assume, hopefully, that a large group like ours works with a lot of pharmacy learners, and that is true. We have students from both Oregon State and Pacific University, Oregon, who rotate with us, as well as our large PGY1 residency program and our own PGY2 in primary care or ambulatory care. But in addition to working with our pharmacy learners, we also do a lot of education for our physician and APC providers. We have 3 medical residency programs that are part of Providence, as well as educating our well-established providers in the clinics. The pharmacists are a very important part of the education strategy for the medical group, and we're involved in numerous presentations, and we have some formal publications for our educational efforts. And now some of the more casual educational efforts that we're doing, we're kind of rebranding as academic detailing. And this is going to continue and I think enhance our educational efforts for our providers. And of course, pharmacists can't talk about education without talking about our patients. And so this is also a large part of our work. How does the pharmacist's time break down is often a question that comes up, and so I wanted to spend a little bit of time on this. If you kind of were doing the math as we were talking, we have almost 50 primary care clinics across the state and about 23 primary care clinical pharmacy specialist positions right now. So mathematically that does work out that each pharmacist has about 2 or 3 clinics. How much time the pharmacist spends and how those clinics are assigned largely depends on the clinic size. But Providence has been participating in the Comprehensive Primary Care Initiative, CPCI, and now CPC Plus, which is a CMS program. and it's working to transform and innovate primary care. So as part of this program for the last, now I think 7 years, our clinics receive additional funding for case management and medication management, really, as part of the goals of that program. And so some of the clinics are dedicating that funding, some of that funding explicitly to increase the amount of time that they have with pharmacist support. And explicitly, they're trying to have the pharmacist target population health management activities and continue to work with the team to innovate our care models. So within our clinics, some of our clinics are quite small. We have a couple clinics that have like a single provider and less than 2,000 patients. And we have very, very large clinics with 15 providers and almost 20,000 patients. So the amount of time that the pharmacists spend in those clinics and how many patients are under their purview from a global perspective can vary quite a lot. And so our current range is for each pharmacist is between 8 and 35,000 patients in an individual clinic. We have improved this ratio over the years, and my goal is to continue to improve it both in getting less variability and moving towards a more optimal low number of patients per pharmacist. Because we have found that when pharmacists have patient ratios in kind of the lower numbers, they are able to not only meet the needs of the clinic by responding to referrals and consults, what we kind of term as reactive work, but they're able to do a lot more proactive activities with population health management. But regardless of how the pharmacists' ratios play out, really their weekly activities often look pretty similar. So 40% of the time, and we often use half-day block type intervals to help break the week up, about 40% of the week is for office visits, for face-to-face. And these are usually for new patient appointments or for patients who need continued face-to-face management for a variety of reasons. A lot of our follow-up visits are done by telephone, and as I mentioned before, we're continuing to explore other technologies that would help us to do care kind of virtually. In a busy clinic, as many of you probably have experienced, doctors have questions, and those questions may come up when you are busy with patients. And so we have long had cross coverage for that. So one half day every other week, each pharmacist will have a consult shift where they are responsible for addressing any urgent questions that might come up during that time. So you can rest assured while you're seeing patients, if you're busy in clinic or giving a presentation, but one of your providers has an urgent question, that it's being taken care of. And then one half day every other week, you're the person helping the rest of the team with that. As with all of us, we probably have too many meetings, but we're working on making those meetings as efficient and productive as possible. And those meetings are for both the pharmacy team and any projects that you're working on or things with the clinic. But so about 5 to 10% of the week maybe with those type of administrative activities. And then the remainder of the time, about 30%, kind of is this everything else bucket. It includes the consults, kind of the routine consults from your clinics and your providers, any of the population health management work that you might be undertaking, projects that you're working on, precepting with learners, or providing and developing educational materials. So that is the overview of our department. I hope that this was informative for you. Again, thank you for your time in listening and watching this, and we look forward to meeting you. Thank you.